Why do SLPs quit their job? How to set yourself up for success. SLPs have uniquely beautiful skills and job opportunities. Whether it's to help stroke survivors safely return to the dinner table, or guide tracheostomy patients in using their voice again to tell their family, "I love you," for the first time in weeks or months, our work changes lives. So why would any SLP want to quit their job? Might sound like a silly question, because there are plenty of jobs out there people would want to quit regardless of the career. But for SLPs in particular, what challenges or barriers might we encounter that could push us to want to leave it all behind? I'm going to get real with you today and have an honest discussion about why some SLPs might want to quit their job. Of course, each job and situation is unique, and this one video cannot cover it all. But I can at least highlight some of the more common barriers SLPs might encounter that could result in a letter of resignation. Let's dive in. I'm Teresa Richard. I've been a medical speech pathologist for 15 years. I'm a board-certified specialist in swallowing and swallowing disorders. I'm the founder and CEO of the MedSLP Collective and MedSLP Education. Lack of respect. Let's face it, many of the people and organizations that hire us don't even know what we do. Since many of our bosses are not SLPs, possibly not even therapists, possibly not even a person with a healthcare degree, sometimes they don't understand why we need certain tools that we need. Things such as access to video fluoroscopy, or FEES equipment, or certain testing materials. They hire us because they are supposed to have an SLP. We may end up being just an afterthought in an organization due to no fault of our own, but just a general misunderstanding of what we do and the value we can provide. SLPs might show up to jobs that have no supplies, no materials, no budget, and no clear idea of how SLPs should be utilized during a patient's healing process. For a new grad or even an experienced SLP with limited knowledge of certain settings, this can make us feel like an outcast. So the SLP is put in the position of doing a job for which they do not have the necessary tools. Often quitting feels like the best way out, but then so the cycle continues. An SLP takes that job that doesn't have the supplies they need, and the supplies then never arrive. The SLP ends up leaving, and so on and so on. I wanted to highlight this because I've seen the cycle perpetuate, but I've also seen some amazing SLPs put a stop to the madness. It can be tough when it's difficult to find jobs. Do you take a job that may not have the materials or a budget for you and hope that you can be the change in that facility? Or do you walk away from that job because you might not be heard? That is only a decision that you can make based on other factors in your life. But I do want to encourage you to be the change if you can. We've had many success stories in the MedSLP Collective where SLPs didn't have budgets or materials and went on to educate and advocate for the materials that they need. We've had many SLPs discuss program development and how they've created entire departments. It can take a long time. It doesn't happen overnight, but it's entirely possible with a little grit and determination. I'll be posting other videos just like this one that you won't want to miss, so make sure to hit that like and subscribe button and turn on the notification bell. Also, do you have any specific questions about how to set yourself up for professional success? Leave a comment below and tell me about it. We'll be sure to get your questions answered as soon as possible. Too high productivity. It is not uncommon for a therapist in a healthcare setting to report that their productivity standards require them to be doing something billable 85%, 90%, even 100% of the time. In the 2019 ASHA Healthcare Survey, productivity was defined as the number of hours in direct patient care divided by the number of hours worked, with the average reported being around 79% productive, which is usually totally doable. Now, if your facility requires you to be on the higher end of this percentage, closer to 90 to 100%, it can be essentially impossible to even take a bathroom break. This has led directly to burnout faster than any other parts of our jobs. SLPs are often made to feel like a failure or as if they are not a team player if they don't consistently meet these lofty and arbitrary standards. In many cases, the people assigning the productivity do not have a clue about what is expected of the clinicians or even what CMS and other insurers consider billable versus non-billable time. In many cases, productivity is completely decided without any input from the clinicians themselves. So what can be done about it? Well, there's a few options. Advocate for lower productivity by keeping track of all of your tasks for the day. Most times the administrators don't understand everything that goes into our jobs that are not considered billable or skilled. On that note, once it is determined what exactly goes into your day that you're required to do, see if it's possible to get some help. Sometimes just educating the CNAs to see if they can help to get a patient up and dressed can help, or asking if the rehab techs can help you out with your patients. Sometimes OT and PT get all the support and we're left to fend for ourselves. Consider creating SOPs. This is a fancy term for standard operating procedures, which is basically a checklist of things that you do repeatedly. So if there is a procedure for submitting a diet order, following up with everyone involved, or scheduling a swallow study, try to streamline your procedures as much as possible. Then if possible, hand this task off to an assistant or aide if your facility allows that. All that being said, there are some companies out there that just don't care and want you to see as many patients as possible, bordering the lines of ethics, and it might be wise to look elsewhere, because there are ethically run facilities out there that have reasonable productivity requirements. It might be a lower hourly wage or salary, but it's ultimately up to you what you value in negotiating your rate versus productivity. I remember working at a facility earlier in my career that had a 92% productivity requirement. I was the only SLP and there wasn't any other support available. I remember venting to my boss, who was a PT, about the outrageous productivity, and he told me to write out every single thing I did during the day. Once I did that, we were able to identify some things that the CNAs and rehab aide could help me out with. The CNAs were more than happy to help out once I explained what I needed, and it really just required a lot of communication about what we do. I was also able to get my productivity lowered once I educated them about a lot of things that we as SLPs do that are not considered skilled or billable. Lack of fulfillment. We often emerge from graduate school with dreams of working in settings that are sometimes hard to get into. Acute care or a voice clinic may be out of reach for most SLPs, but they are both highly desirable locations for employment. Clinicians will sometimes take jobs that leave them unfulfilled. For instance, an SLP will go to work in a setting that is not of their choice in order to just make a living. So how do we fight dissatisfaction and malaise? Deep dive into learning a topic you do have an interest in. Become an expert in that area of study, even if you are in a location that will not benefit from that particular knowledge. If you have the knowledge, your time will come. The best decision I made in my career was to specialize in an area I was truly passionate in. I didn't know anyone in my area that was passionate about dysphagia, and not just dysphagia, but dysphagia assessment. I started taking a lot of courses and reaching out to mentors for training. It was a lot of time and money on my part, but the rewards were priceless. If specializing in something isn't your cup of tea, perhaps just trying a new setting or applying for a new challenge may be the key. I think oftentimes SLPs get stuck in a setting and think that's as good as it gets. We have many stories in the MedSLP collective of SLPs challenging themselves to step out of their comfort zone and apply for different positions or settings. It might just be the change you need to rejuvenate your love and passion for this field. If you'd like even more support and resources to help you in your medical SLP career, I invite you to check out the MedSLP Collective. Go to www.medslpcollective.com and check out our membership options. We offer monthly webinars, weekly resources, and daily community support to help you with your toughest clinical cases.